Hello everyone, with you Dr. Demchenko, and today I will tell you how to relieve pain in intervertebral neuralgia. Let's go! People often have pain in the rib area, and a fairly common diagnosis in this case is intercostal neuralgia. In fact, true intercostal neuralgia, that is inflammation of the intercostal nerve, is frighteningly rare. Most often, the pain occurs due to a rib dysfunction. That is, the rib stops moving well and a problem with the intercostal nerves begins. That is, with the compression of the intercostal nerve due to the spasm of the intercostal muscles and poor rib mobility. I want to show you a good technique on how to get rid of these symptoms. How to understand if your rib is moving well and if there is pain in the intercostal space. First, you need to do a test for the mobility of the thoracic spine and ribs. To conduct the test, sit on a stool, cross your hands on your chest, and try to turn to one side to the maximum and to the other side. Usually, if a rib is blocked, then when turning to one of the sides, you will feel quite strong pain either in the place that bothers you or pulling sensations around the spine, which go along the rib. Usually you will see that rotation is better to one side and worse to the other. Conduct such a test and see which side has better or worse rotation. Next, if you find a spot where there are pulling sensations, these pulling sensations on the spine will most likely be slightly at a different height level than the sensations from the front part of the chest. Why? Because the ribs are inclined. So, for example, you may feel pain in the spine at this point, but at the same time have pain in the intercostal space a few centimeters below. The second sign can be pain in the rib area, which occurs during deep inhalation or exhalation. Often during deep inhalation, try to take a very deep breath. And a very deep exhalation. If you feel that your pain sensations change from inhalation and exhalation, this will also indicate that you have a problem with the rib. Now let's try to improve the rotational movement of the rib. That is, when we turn, we will try to catch that rib that does not turn and somehow pull it along with the body. For this, we need to press the rib with the outer part of the palm. You need to feel the most painful and protruding rib, or just put your hand approximately at the projection, where it pulls you when you turn around the vertebra in this way. Firmly press your hand to the rib, and when you start to turn, stretch the rib further with your hand. Such is the movement, as if you're helping yourself to turn with the opposite hand. If you hit the right spot and do everything correctly, then the pain should significantly decrease and the rotation should increase. If you didn't hit it on the first try, please try one rib lower or one rib higher. Also, apply pressure to the chest bone and make a rotation. It's very important to make the rotation all the way to the end, as far as you can manage. Repeat this 10 to 12 times. After this, try to move, twist, take a breath in and out, and see if your pain sensations have decreased. This exercise will be good if your pain is mainly at the end of the breath. The thing is, this pain mainly arises because the rib seems to get stuck in the exhale position. That's because when we exhale, the ribs go down, and when we inhale, the ribs go up. If we put our hand on the side of the pain as a support and press down, including the chest muscles, then the chest muscle will sort of lift the rib up, helping it to inhale. That's why in such a position we can usually pull the rib out of the exhale position and improve its mobility. Put your hand in place and start pressing down. The force of pressure is about 30% of what you can develop. Maintaining the pressure, we start to take a deep breath in and out. If this technique works, then you should immediately feel a pain at the depth of the breath. Do this for 10 breathing cycles. Don't rush. It's very important not to release the pressure on the hand and to breathe deeply and slowly. Let's give it a try and do it. The next technique will be good if you don't have inflammation in the area of pain. Usually, if you have inflammation, then this area becomes hotter and hurts at rest. The pain is shooting, not requiring movement. If, however, our pain is mainly caused by a mechanical disruption of mobility, then the pain will only occur during movement. Accordingly, if your pain is only triggered by movement and does not occur at rest, and does not cause burning and hot sensations in the area of pain, then you can try the following technique. Take any heater or a bottle with hot water and apply it to the place of pain for 10 to 12 minutes. After this area warms up and the intercostal muscles relax a bit, first try to do a superficial massage. Start making circular motions in the pain area with this part of the brush, and don't rub against the skin but press a little against the ribs and move the entire skin with all the tissues in the pain area to one side and the other for 15 to 20 movements. After this, you can try to stretch the intercostal muscles. To do this, find the most painful intercostal space where the intercostal muscle spasm most often occurs. Place your fingers close together and press on this gap. Try to find the pain. Now, when we pressed on this spot, it's usually a bit painful. You can try to breathe slowly and deeply, keeping your fingers in the intercostal space. Normally, the first 10 breathing cycles can be painful enough from the pressure. But when we do 15 to 20 breathing cycles, usually the pain decreases and then you will have good, pleasant feelings of relaxation in this zone. After all these procedures, try again to check the rotation of the thoracic spine and deep breath. Usually they improve and the symptoms drop more sharply. If you feel sharp shooting pains that hurt you at rest, as well as changes in skin coverings, or for example a rash on the skin in the area of pain along the nerve, be sure to see a neurologist before working with the rib. Because this can be a real intercostal nerve and causes severe pain, as well as a rash along the intercostal nerves and causes severe pain, as well as a rash on the skin along the nerve. Try these techniques, share the result in the comments. If you can't do something on your own, come to the Dynamika Clinic in Moscow and we will definitely help you. Good mood to everyone and bye.